Hi, everyone. My name's Caitlin. I'm a holistic nutrition consultant and the author of a blog called grassfedgirl.com. We're so excited today. We have CoachStephen from UK Carnivore. He is a personal trainer and a phlebotomist. He has a great story to tell us all about his carnivore journey. So stick with us all the way to the end, and we're going to hear some tips and tricks about how to do carnivore and hear his wonderful story. Welcome, Stephen.
Hi there, thanks for having me on. I'm going to tag on a couple of other qualifications, if that's okay.
Yeah, I want you to.
I'm a specialist practitioner in obesity and diabetes and have an honours degree in science, which is in physiology and health sciences. So
Just a little
quite a
bit
lot.
there.
Yeah.
Yeah. Well, that's amazing. So he is just interviewed me for his channel. So watch out for that. And now we're going to hear your story. So why did you get started on carnivore, and tell us about your health journey?
Right. Okay. Well, I was not carnivore until I was 55. I'm 59 next week. So I've been doing carnivore nearly 4 years. Before that, I was keto. And we were just speaking before you started recording, because I was very interested in some influencers like Dr. Eric Berg and Thomas DeLauer, and obviously Ken Berry and Paul Saladino when he wasn't doing what he's doing now. And I was keto for a few years, and I started low carb when I was 50. But the reason I started looking at some other way of eating was, even though I was trained in obesity and diabetes in my 40s and a personal trainer before that, I was getting sick. I was getting fatter. I had lower left quadrant pain. I had a coronary artery calcium score of 639.
Oh my
And
goodness.
yeah, it was awful. And basically, I had a big rash here that used to come out, like somebody got a strawberry and smacked it on my head. Athlete's foot, bloating, just basically everything was going south. And the biggest mystery for me then, not now, is I was doing everything correctly. I was eating the healthy diet, and I don't smoke, I don't drink. I'm active. I was a semi-professional soccer player in my teenage years. I did a bodybuilding show in my 20s. I was a middle distance runner in my 30s and 40s. I was having skim milk, no red meat, no fat. I was having freshly squeezed orange juice and doing all the right things, basically healthy whole grains, cereal in the morning, oatmeal or porridge, as we call it here. And everything was going wrong. Absolutely everything. So it wasn't activity. It wasn't that I smoked. It wasn't that I was drinking. I wasn't particularly stressed. I wasn't in an environment that was going to cause me problems, because obviously there is things outside of food that could have caused me problems. And it just really, when I started to learn about diabetes, this is the only reason I mentioned it, is it became really obvious that carbohydrates were the problem with diabetes. And that was down to some really basic understanding. As soon as I started to learn about dosing of insulin and other medications, it was always in relation to carbohydrates. And because I hadn't come from a medical background, I was the one putting my hand up saying, this is crazy. Why not just reduce the carbohydrates? So I basically realized that that was a problem. So I went low carb when I was 50. And all of those things that I just mentioned started to improve. Not go completely, but definitely they improved. I lost some weight. And I know there's people out there go, well, yes, water weight, but it wasn't. It was also fat, definitely. And I've always been, because I've been doing the personal training a long time, I had the fat calipers, I had a proper, scanner. I'd also go to get a scan, a body scan. So I knew that I was actually losing body fat as well as water initially. But then low carb was okay, but it didn't cure everything. And then I went keto because I think the science was quite convincing. And weirdly, I seem to do the same journey as Ken Berry in parallel. Not that he knows me, I've spoken to him since, but it was really interesting, because as he started to sort of reduce his veg, change his tack about green, I can remember him doing a video going, eat your greens. And I can remember thinking, well, I'm thinking that's possibly a problem. And then he went carnivore, I went carnivore. And that's when everything did go, every single thing, even the little things like athlete's foot completely went. I just didn't think about food all the time. That was another one. In May of last year, I realized that I'd gained 9 pounds of muscle, because obviously
Oh,
as a trainer, I'm interested in training. I have done an experiment recently where I didn't train for a long period of time, so I lost a little bit of that. But it was just fixing all those things. Now, I will say, I normally get a comment in the YouTube comments saying, did you retest for the coronary artery calcium scan? I haven't done that yet, because due to the restrictions, there is a million patient waiting list, or million plus patient waiting list in the NHS. So I'm not going to go in and take someone's slot for a bit of biohacking. So as soon as that waiting list has gone down, I will do a retest. But anyway, I'm pretty convinced I'm doing the right thing for my coronary arteries. When I had the scan, literally I was in the top, like 1% most likely to die within the next 12 months. It's that high. When Bill Clinton had his triple bypass, his CAC score was 1,000. So mine was 639, so pretty high. And I don't feel any ill effects. I don't worry about it anymore. And when I had the lower left quadrant pain in the colonoscopy, which was in my 40s, right at the end of my 40s, because I'd lost my parents very young. I was very young when they died. They were young, actually, to die. My mum had colon cancer, and she was a cereal eating, low fat, don't eat the fat, don't eat the red meat person. And she got colon cancer. She didn't have a lot of meat. So when I was sitting in the waiting room to find out what the result of the colonoscopy was, I was absolutely convinced then it was all genetics and I was going to get colon cancer, and it is all genetics, and absolutely isn't. It's the environment that your parents put you in. I think that's, you eat what they eat. That has a very big factor. And I think I've sort of proved that to myself, because by changing the way I eat, I've changed the way I look and changed my health. So that's that's the long story, I suppose, condensed quite rapidly. But the bottom line was, all these different things were going wrong with me. I was also getting fatter. That wasn't a big consideration, but losing that weight was obviously beneficial. As a personal trainer, you don't want to be a little bit tubby and carrying a bit of extra weight.
wow, that's a really interesting story. I think so many people can relate to that calcium score, and worried about heart disease, and so many people are so worried about cholesterol and LDL. And have you had those things tested again since you've been doing carnivore? Not
Oh
the
yeah,
coronary, but the other.
yeah. I mean, I'm lucky, because being a phlebotomist, I could do it, and sort of fast tracked the labs. Couple of interesting things was my testosterone at 55. Before I went carnivore, I measured it, and 3 months afterwards, I measured it once I'd been carnivore, and my testosterone at 55 had gone up 30%. So that's completely naturally.
And
And
you
I'm
hadn't
not
changed.
training any.
You didn't change
Yes,
your exercise dramatically. You just kept doing the same.
yeah,
Some people
absolutely. And that,
think, with weight training, it can go up by, with just that, but you were already doing that.
yeah, absolutely. And I mean, that's why, the science degree is really handy, because I know how to do an experiment, and why I pull my hair out when I watch people on YouTube, because they always try one thing and then add something else and something else. And you think, well, you don't know what's working there. So that's a little tip for people watching. If you want to experiment with, say, a food that is being problematic, eliminate a lot of foods if you want, and then enter into a sort of 1 week of eating the one thing you think might be causing you problems. So maybe if you're thinking eggs are causing you a problem, but it could be fish or whatever, take them all out and start again, eliminate down to sort of beef, salt and water, and then add an egg and see what happens. Add 2 eggs, and build up. And then you think, oh, well, maybe it isn't the eggs. And a week later, add some fish and see what happens. And I think that, for me, it was interesting. I'm not worried about LDL, absolutely not at all. I mean, I've even done videos on my YouTube channel about higher LDL seems to be, correlated with living longer. Actually, I'm more interested in HDL and triglycerides, and there's a lot more nuance to the bloods anyway. I don't want to get too nitty gritty with it, but
How is your how have your diabetes markers been?
Oh, absolutely perfect. I mean, so the blood glucose, I did a measurement a couple of days ago because I am doing an experiment right now. And my blood glucose in the morning was 4 because it's the UK. So that's about 80. And my ketones were 1.8. And then the next day were 2. And my blood glucose was like 92. So yeah, I'm quite happy with all of that. Yeah, I'm not worried at all about diabetes, or I'm not worried about my heart, actually. I just feel very confident this is going to be the best way to proceed.
Well, I think it's doing wonders for your skin. And I would have never thought, you said you were how old? I thought you
59
were like,
in a week.
what is it?
59 in a
59.
week.
Yeah. I
Yeah.
thought that's what you said. I would have thought you were about 45 or so. So you're doing something right.
Yeah,
Um,
thank you.
so tell us about your typical day of food. What do you eat in a day?
Well, I've just interviewed you, and you're very similar to me, as in quite intuitive. I guess I end up about 2 meals a day. But I do 100% go with my hunger. I stop when I'm full. I don't think about food all the time, which is the great thing about carnivore, and definitely something I've experienced more in the last year, since May of last year, actually, where I realized I was probably under eating a little bit. So I just made sure that I eat enough now. And it's very counterintuitive for people that haven't done this, but when you start eating more, you end up very often eating less overall in the long run, because you are full and you're not thinking about food, and then you might go a little bit longer. But anyway, yeah, so 2 meals a day is sort of average. I tend to have, if I have my first meal before about midday, then it probably will involve eggs, maybe 4 or 5 eggs, poached eggs normally, maybe 3 if it's poached, maybe 5 if it's scrambled, and I don't know why that is. I do get some sausage meat from a local butcher, which is particularly nice, which isn't full of processed rubbish. And maybe some bacon. I mean, very traditional, basically bacon and eggs. If I don't eat in the morning, I tend to eat in the afternoon, then I would go straight for things like, at the moment, I'm having a little renaissance with chicken thighs with the skin on, which are crispy, which are very nice. I like fish, although before I was low carb, I was allergic to every fish, and I was hospitalized twice eating fish, which was in things that I didn't even know contained fish. But now I can eat all the fish. So I do like fish, and
Wow.
obviously ribeyes, T-bones, fillet steak, sirloin. I mean, I love steak. Steak is great. And ground beef, ground beef patties. I like to sort of mimic a burger, which is why in the last interview I loved, because you did something for your husband, which is what I do. I sort of make it look like a burger with like a patty and some cheese, and another burger and it's a bit more cheese, but I don't have the bun. Exactly the same thing, but it looks like a burger on the plate. So yeah, 2 meals a day. I'm not a fan of fasting. I mean, obviously, if you're doing 2 meals a day, there's a bit of intermittent fasting going on anyway. But if you want to lose a bit of weight, or you want to get a bit sharper, then I think fasting is pretty good. If you've got fat to lose, if you're lean, I don't think you need to fast unless you're really thinking about something in a therapeutic way. Possibly it could work, but yeah, I tend to eat till I'm full, really, and when I'm hungry, I'll eat again.
Yeah, I think that, I mean, I feel like if you're worried about fasting, to me, it puts me in that negative headspace. And then I tend to overeat because I start to feel restricted, and then but I think people miss the benefits of the fast mimicking that carnivore has, like with the ketosis and the protein sparing, because like you don't lose your muscle. So I don't think you have to fast as much as people, some people think you need to. You're still getting a lot of the benefits without fasting. So when you're in your clinical setting or at work, do you get to sprinkle in your knowledge, or is it prohibited?
Well, no, everything I do is private, so people come to me. So I'm not really tied to anybody. So that's the main thing. If people contact me, normally it's because they want to go low carb, keto, or carnivore, because that's where they've seen me. That's where they've heard me. In my rehab practice, I do a little bit of rehab. I always talk about nutrition, but I never push it. If someone's got a bad knee and they're constantly, saying that it flares up and it gets injured too easy, I will always ask, what are you eating? A classic one is, like their big toe hurts. And normally, if they're not interested in nutrition, I say, well, look, at least cut out tomatoes. See what happens if you cut out tomatoes. And 9 times out of 10, I will get a text. The last one I had, about 6 weeks after I said that, I just got a text saying, what a smart ass you are. Yeah, that worked. So but even people that are reluctant to believe it will try it. I mean, that particular person was in a job where they have to be on their feet all day, and they're going to lose their job because they couldn't do the job that they was designed to do. So I just said, honestly, if you want to be able to walk and get to your pension, I was only a year away from the pension. Just take the tomatoes out. So even sort of low impact advice like that, where that there's certain inflammatory foods that can trip people up, taking them out can make a big difference.
Are you thinking about the nightshades, or is that what you're?
Yeah, there is anti-nutrients in lots of things, but yeah, like the nightshades tend to be quite problematic and inflammatory. And I think that's a really easy bit of advice for most people to, if they've got feet problems and pains, to take tomatoes out. And that is one of the weird things that carnivores still sort of want to do. They want to have ketchup, they want to have something tomato based every so often. And I would say, well, maybe you need to take that out if you're still having problems. If people can tolerate something and they go in with their eyes open and they know there's a potential, even if it's something, let's say bread, use that as an example. Someone says, I occasionally want some toast. And I'll always say, well, does it play your system up? I mean, does your belly start to feel bloated? Do you feel a bit sick afterwards? And if they say, well, yeah, I say, well, it's probably gluten. I wouldn't do the bread. But if they don't have any problems and they want to eat that, I have no problem with that. But on the other side of the coin, when you really get to know that person, you say, look, you'll never know how good you can really feel unless you're 100% carnivore. At least do it for 30 days and then you can make an informed decision. Because if you feel so much better, the decision to drop bread, for instance, will become really easy because you just want to feel this good. And again, that tends to work pretty much 99% of the time, because there are so many people that have this little, well, I can't give up this, or I can't give up that, or I want this every so often. And when you drill down into how does it make them feel, very rarely does anyone say, well, it doesn't affect me at all. Normally the thing that's not carnivore that they want will actually cause some issue of some description. So
I know you were a personal trainer for a long time, like me. And what did you feel any limitations in that? And why did you kind of cut back on that?
Yeah, well, actually, so that's strange because I deliberately specialized in training athletes that had diabetes or were obese because I wanted to get the results, and I didn't get the great results when I was high carb. I really didn't. I got results, but they were just temporary and they weren't really going to stick. I didn't think it was sustainable. As soon as I went low carb, actually, I started to see big results. So although I don't recommend personal training for weight loss, a lot of people did it for weight loss, but I would always say nutrition is key to your weight loss, and the training is like the icing on the cake, or now I say the butter on the steak. But I would celebrate before I got to age 50. I would celebrate someone losing 7 pounds. I would think that was amazing. And now I can get long list of clients that have lost like 77 pounds or 60 pounds or 150 pounds, so there's a huge difference. But I was pretty lucky. I trained people in the Olympics, like a javelin thrower, and she was type 1 diabetic, which is how I ended up doing that particular client, and nutrition was really important. And we did talk about carbs and what the rules are and what in reality would work. We talked about that, but I had to stick with the rules. And I think that is really upsetting. That, you know, I think she would have been better fat adapted, and I think the type 1 diabetes would have been managed better if we didn't have to stick to what the rules and regulations say. So I'm glad to be out of that, because I like to do the job to the best of my ability. So if someone sees me as a carnivore coach, books me as a carnivore coach, we can talk about carnivore.
And you don't have any big brother watching you.
No, no. And I think, you know, the more you do it, I mean, I'm now 4 years of carnivore coaching, and obviously I do fasting coaching and I do low carb and keto, because, you know, I know all about that and qualified. I'm qualified in all the nutrition and performance nutrition as well. But it's very frustrating to have that knowledge and not be able to impart it. So I think it's good that I'm now in sort of like a niche where
Yeah,
people
that's
are
really
coming
good.
for
I
that
mean,
thing.
one of the things I was frustrated about when I would keep learning new things, and then I'd try to tell my people who had me from a long time ago, they didn't want to shift the information. They just wanted to, they were like, but I liked when you told me to eat 6 meals a day. And I was like, well, but I don't believe in that anymore. So like, they didn't want to come along with me as my change of knowledge. So that could be frustrating if you know somebody a long time. So now let's talk about some of the trends in carnivore. What do you think about this new thing, the sardine fast?
Well, first, it's not a fast because technically you're still eating. I understand why people are calling it a sardine fast. Well, I've not recommended it to anyone. I understand it works for people, which I'm totally fine with, but it is not really getting to be intuitive about the way you eat. And I do have 2 clients that have tried it and actually had a bit of a rebound issue afterwards, where they can't get back to where they were with their hunger and satiety. And that sort of makes sense. I know it's only 3 days, but it seems to have messed them up a little bit. But then there's other people that have had great success. Not a fan. I'm just not a fan. But I am a fan of eating nurse to tail and sardines, and I think that there is a place for sardines. They're a great snack. I had sardines a couple of days ago because I wanted a snack, so they're really handy. And a good source of so many different nutrients, omega-3 obviously, and calcium, as I said. So yeah, it's okay, but it's not something I would go to town on. If someone's got a weight loss stall, I would look at other things first, like anxiety. Are they sleeping? Is there anything epigenetic? Is there something else going on in their life? Their activity levels. There's so many different things you could look at, and also what they're eating, because there could be a reason. Very often, the problem is malnourishment. They're not eating enough, or they're not eating the right things for them, or their timing is wrong. There's so many other things you could tweak first. So if someone says, well, I'm eating sort of 7 o'clock in the morning and then 7 o'clock at night, that might be an eating window that just is not working for them. Whereas maybe they need to not eat so late at night, or not eat so, you know, early in the morning. It depends on so many things. I think it's a quick fix, certainly something you can easily sell online and say, right, try this, see if it works. And you'll get a big percentage of people that it'll work for. And they'll say, this is brilliant. I lost 5 pounds and I've got ketones. And I get why it's popular. So I'm not anti it either. If people want to try these sort of things, that's how we learn, isn't it? What you just said. You know, you thought 6 meals a day was good. Now you don't. I think because I've had a couple of people worried about it, I'll sit on the fence.
Yeah. What do you think about the 80% fat and the butter, all that? Eating butter, all sticks of butter all day.
Yeah, again, it's the same thing. I mean, I feel you don't want to undereat protein. That's the first thing. You want to make sure you get the right amount of protein. And this is where it isn't down to numbers. Again, it's down to how you react, how your body composition looks, energy, how you recover. Make sure you have enough protein. I'm not a big fan of counting anything, tracking anything. In saying that, if you look in the mirror, you're tracking. You know, if you're looking at the holes on your belt, you're tracking. So that's okay. But I think anything where you start getting into the maths and calculating percentages, possibly not the best way to go. I still think being intuitive is best. If you look at the fat to protein ratio of a ribeye or an egg, they're pretty much 1-to-1, you know, by weight, which is the important thing. And it's pretty good. So I would start with eating the whole foods. If I was new to carnivore, I definitely would recommend that. I wouldn't say add butter, see what happens. And if after a couple of months, your body composition is, if that's what you're interested in, losing body fat, if it isn't going the right way, then I would, you know, consider whether you need to drop your fats or up your fats. If you've come from a background, this is what I found in general, normally females, and their thyroid is packed in, and they've come from a background of calorie restriction and low fat, possibly, you know, my gut feeling is they will probably do well initially with slightly higher levels of fat. But it's not a thing that you just have to do for the rest of your life. I think it's something to, even if it worked, let's say, use that example, someone's come in, low calorie, thyroid's packed in, they've on, or low fat diet or whatever, then making sure that they have plenty of fats initially might work, and they might feel fantastic. Obviously, there's an adaptation period where, you know, the bile production might not be up to it, the fat, you know, absorption might not be up to it. But I think that's it. I'm basically saying it's all very individual, but
Yeah.
it definitely has a place.
But so what macro do you find that your people feel the best at, like in general, or a range? I mean, I know
Yes,
it's all
it's a
individual.
range. It's so variant. You know,
People want you to say, they want you to pin it down.
yeah. I think you know, how I tend to do it is not say add fat. I tend to say try to go for fattier cuts of meat, or eat things that have more fat in them, or eat more egg yolks, and get it that way. If they need more fat, and if they need to dial back on the fat, then, you know, go for leaner cuts. It's really that simple.
And what kind of exercise do you tell your people to do?
Well, again, sorry, I'm going to sound like a broken record. It depends on their aim. So if they want to gain muscle, then I'm a big proponent of very short, hard, intensive workouts, maybe 3 times a week. I mean, me personally, I will do 15 minutes, no more than that, 3 times a week, maybe 4 times, if I want to push it a bit. But it's pretty straightforward. You just lift heavy things to fatigue. You don't need a myriad of programs. But if someone comes to me and they want to get fit, but they want to do endurance, they want to run, then obviously I would give them a training program that's based around running or cycling. I had the other day an ultra marathon competitor wanted to do that. So the training is revolved around that. So it's all very different.
You think they can do that without carbs?
Oh yeah, absolutely. 100%.
And better. Didn't you interview Michelle Hearn?
Yeah. Yes. Yeah.
I thought.
Yeah, and you don't need carbohydrates. See, the thing is, it's a very nuanced thing when people go online and they say you have to have carbohydrates to work out. That's true. You do need, but you don't need to eat them. That's the thing they miss. Your body makes the carbohydrates you need from non-carbohydrate substrates. That's what the liver does. So gluconeogenesis is not to be feared in this particular instance. And it will do it. It will be demand driven. It won't be anything other than what you need. So you can definitely do it. And when you're fat adapted, if you take a lean athlete, an average lean athlete, and I hate this word calories, but people understand it, you've got about 2,000 calories of sugar energy on you. If you're a lean athlete, you've got about 54,000 calories of fat energy available. So it's a better energy source once you get into using it. So I've run half marathons, and I can remember running around and, you know, having slices of orange juice and gels and stuff like that when I was high carb. Well, I'd be able to do that without carbing up, without doing anything, because I've got enough energy reserves and I'm fat adapted. I could just run a half marathon, no problem.
I never did it again after I got sick, and I wonder how if I got, but because I just attributed running to my health breakdown. So I wonder what it would feel like if I got, of course I'd have to practice a lot to get able to run again, but yeah, that's interesting. I remember bonking out and being like, ugh, I have to have that hit of sugar, and you had to carry it with you. It was so crazy. Like, and you just completely hit the wall. So, well, I think anyone who works with you would be really benefited by your knowledge. So how can people find you?
Well, the easiest thing is the ukcarnivore.com. That's my website. And I'm also the UK Carnivore on Instagram. I also have the Carnivore Experience app, which is on the Google Play and the App Store. So there's plenty of ways to get me.
That's your YouTube. I mean, your podcast. Right. I was trying to get to it. You don't have the Apple link. And I was like, I can't listen to it. But I put it on my YouTube. So I went to
okay.
from YouTube.
Okay. Yeah.
But,
you have to talk to me about that later, because I thought you can get my podcast on Apple, definitely.
maybe it's just where I saw it on your Instagram. It didn't link directly to it, but I'm sure if I searched on the podcast, I could find it.
All right, cool.
But I just looked at YouTube anyway, so that's just as easy. And yeah, you guys, I will link down in the description to your Instagram, and from there you can find all of Coach Stephen's information. And it has been really fun talking to you today and getting to know you. And watch out for both of our interviews coming out soon. So I really appreciate it. It's really nice to meet you. Please share this information with a friend, subscribe, leave a comment, tell us what you thought about today's interview, and we'll see you next time. Thanks so much. Bye-bye.